So next up is myStrength.
Got it. Super, thank you. So we're thrilled to be here. I'm thrilled to be here today. Thank you for the consideration. I'm also incredibly excited in that for the 9 years that I've led the company, this is one of the first times that my mom and dad actually get to see me speak about the company. So, hi, Mom and Dad. Want to shout out and remember the easy questions that we talked about. So myStrength is a digital behavioral health platform. We're based in Denver with folks across the country. Our mission is to provide interactive self-management tools that really help to complement the traditional model as it relates to behavioral health. Very quickly, the why before the what. So we started the company, myself and a co-founder, kind of the convergence of two worlds. The first, I was an online university president, scaled a pretty sizable organization, and saw on the front line how digitization was impacting higher education. On the personal side, 25 years ago, I struggled with depression, debilitating depression, and resisted any and all forms of treatment due to stigma, and Andre talked about that earlier, was blessed with loved ones who helped me overcome that, seek out care, and had a life-changing outcome. And so these worlds converged 9 years ago when I was leading a 600-person company, and we were looking at our healthcare costs. And not unsurprising to those in the room, we were seeing a strong representation of behavioral health, stress, anxiety, depression, substance use disorder. And we asked our insurer to come in, not represented in this room, and showcase self-management tools in those categories, anticipating that there would be a plethora of innovation in the space. Quite frankly, we found the opposite. They came in with their depression program, which was 2 videos and a static article, and they were really excited, talking to a technology company. And so with that, we kind of began to look at the landscape, and we learned very quickly a couple things. One, that 1 in 4 struggle with mental illness. What's disheartening about that is 70% of those that struggle are unable or unwilling to seek out care. And we found a very fragmented, under-resourced mental health delivery model. So with that, that created the North Star for us, not to replace, but to augment and really lift up the access to evidence-based interactive models in the mental health space. What was very interesting and kind of leads us to the context of today's conversation is we really focused first on the Medicaid side. We were blessed with strong advisors, former state directors of Medicaid, mental health, Colorado, California, and we began to appreciate how underserved that space was and the dynamics of increasing access to technology. Along the way, we formed partnerships with the National Council for Behavioral Health. We were selected as one of their 7 strategic partners. So we've become very familiar with the space. At the end of the day, we're trying to create a tool that's incredibly empowering to the individual to allow them to participate directly in their health and well-being while providing benefits to payers and providers. Can we improve outcomes, reduce the cost? All of these are supported by a range of peer-reviewed studies that we'll talk about in particular and conclude with a 2-year Medicaid study that we did across the state of Missouri. We launched across the entire state of Missouri, all of the community county behavioral health organizations, and we were able to demonstrate a very significant reduction in all-cause claims. Many of these dynamics have been touched on. I think it's a perfect storm. Latest data for us, over 70% of those making less than 10K have access to the internet. Other speakers have talked about that. I think what's really exciting for us is there's a growing body of evidence that when you put online psychotherapy tools and make them available through digital medium with the support of clinicians in particular, the impact is pretty significant. I think Andre said it really well this morning. Our view is that technology needs to augment the existing care models. I talked about earlier the fact that many and most who are impacted by mental health are unfortunately unable to seek out care. State of Arizona, as perhaps painfully aware for those in the room, ranks 39th out of 50 in a recent Mental Health America study that looked at not just prevalence that Andre talked about, but the lack of access. And so our view is, can we introduce technology to soften those barriers of cost, stigma, and access while providing an evidence-based solution that again, complements the traditional model? The platform is foundationally based on models like cognitive behavioral therapy, behavioral activation, mindfulness. These are gold standard psychotherapy models that serve as the foundation. And then we build out condition-specific resources that, as you can see, range from stress to recently opioid recovery and opioid addiction. Each of our conditions, we bring in clinical experts to really focus on the clinical components. We bring in consumers to focus on the cultural sensitivities and engagement activities as well. We'll play a short video.
We all struggle from time to time. myStrength is here to help you through it. It's a resource offered to you by healthcare providers and payers, available to you 24 hours a day, 7 days a week. Whether it's depression, anxiety, stress, chronic pain, problems with sleep or substance use, or you just want to keep your emotional health strong, myStrength has a range of tools and resources that are customized just for you. Find inspiration, mood tracking, and hundreds of videos and activities that will empower you to feel better and stay better. Learn more and schedule a demo today.
So as was quickly identified in the video, and we'd be happy to provide guest access to anyone in the room, should there be interest, a range of interactive programs, daily trackers across both physical and behavioral health conditions, in-the-moment resources heavily weighted to mindfulness activities, stress management, coping, crisis management. We also have a range of social interactions, kind of a Pinterest-esque-like capability where folks can post inspirations that we curate. From a coaching perspective, we've recently launched engagement coaching. So our view is that, again, whenever we can combine the best of human touch with technology, we see the best outcomes, not just within our own company, but as we work with health plans. We'll talk about that momentarily. So we've added motivationally interview-trained coaches that are responsible for reinforcement, for navigation on the site, for, at appropriate times, escalation to care management within the plans or within the providers. And we've been very fortunate to work with a number of different health plans, both commercial and Medicaid, that include AmeriGroup, where we launched into several states, CareSource, which is one of the largest Medicaid plans, Centene, most recently Beacon as well. So we've got a lot of familiarity with the challenges associated with a health plan within the Medicaid population, because not only have we seen it from the health plan perspective, but we've also launched myStrength to over 33 states to Medicaid-funded providers. So these are organizations that have integrated myStrength into their care models clinically to manage wait lists, to bridge between sessions, to drive evidence-based practices in their care models themselves. So I think, have a unique perspective in terms of both the payer and the provider in terms of our experience. And I think the last dimension, we've been very fortunate to work with the National Council for Behavioral Health. Early on, they selected us as one of their strategic vendors, and we've spent a lot of time with Linda Rosenberg and her team kind of thinking about this space and how we can use technology to its highest potential. We've also had the benefit of statewide launches. So Dr. Joe Parks, some may know in this room, we had the opportunity to partner with the Department of Mental Health in Missouri and all of the providers, which really provided us this rich opportunity for data gathering and analysis that we'll talk about. We're also seeing a significant uptake as it relates to integrated health systems, particularly primary care practices. 80% of the anti-anxiety, antidepressant medication that's prescribed in the U.S. is done by primary care docs. They're really the tip of the spear as it relates to behavioral health, and so they're looking for tools that can augment the pharmacy solution or the referral, and now they can offer the technology solution, a technology solution such as myStrength. I want to dig in a little bit to the all-cause claim study in Missouri. Very, very fortunate opportunity, 2 years, close to 2,000 participants. We had 1,000 folks roughly of non-users and 1,000 folks that utilized myStrength. We took the first year to kind of equalize and look at any leading indicators, and in the second year after we introduced myStrength, what was the actual impact, control versus the myStrength group. What we found, again, perhaps not unsurprising to this group, is a significant reduction, not necessarily in behavioral health costs, but in medical costs. Lower emergency room visits, lower inpatient visitation as well. This is a peer-reviewed, published study. Happy to share this and any of the evidence or body of work that we've come up with. I think one of the topics, thank you, that is under-discussed, at least from our perspective, is that it's not a if you build it, they will come mentality. Quite frankly, it's the opposite. And what we found is there's a lot of discussion about the technology, and I think rightfully so, but I don't think there's enough conversation about how technology needs to fit into clinical workflow. And so early on, we kind of recognized that because we launched to a couple partners and we didn't see much going on. And we quickly realized we needed to bring in expertise to work with health plans to kind of think about where does this fit in the consumer experience? And where does this fit in the extended provider network? How do we ensure that we go to where the system is and educate and integrate through electronic means, through FHIR integration, and through provider tools. So we've got a teacher's version of myStrength that we launched to care managers and case managers and extended providers because we want them to be excited. Our belief is that if you can win the hearts and minds of clinicians and case managers, you're going to really advance the opportunity relative to technology tools. And then there's a range of resources that we make available to deploy the tool, to communicate the tool out to members. I should have noted up front, big change recently for us. We were acquired by Livongo Health. Livongo Health is one of the leaders, if not the leader, in the digital chronic care space for diabetes and hypertension. A super interesting opportunity that we weren't necessarily looking for, but they came with this incredible vision of thinking about comorbidity. As all of you can appreciate in the room, 20% of healthcare costs are driven by untreated mental health issues associated with chronic health conditions. And so the vision of the partnership is, can we bring in the behavioral health piece, still operate generally as an independent entity, but really fuel and be part of this macro platform. Thank you. Be part of this macro platform that we can offer a range of resources. And I think that's beneficial from two perspectives. One, we're hearing a tremendous amount of app fatigue from payers and providers. There's just so much out there, and it's incredibly hard to piece together multiple solutions. And we know from a consumer perspective, it's even more challenging, right? If you've got 7 different apps that you're putting out in front of them. So I think the vision is super exciting, and we're really looking forward to maturing that partnership. And so with that, I'll conclude with just visually some customer quotes. As I said right up front, what we're trying to do is clearly change the cost dynamics in healthcare. But at the end of the day, as many of us have experienced, we're trying to help people get better and stay better, which is reflected in the slide here. So with that, I'll take questions.